Good afternoon. My name is Bill Martin. I have the honor to be the director of the drug policy program at Rice University's Baker Institute. And I'm joining today the Katharine Neill Harris, Katie Harris, who is the Alfred C. Glassell III Fellow in Drug Policy at the Institute. And Katie is going to be doing most of the talking here. But we're talking about the COVID-19 and the pandemic and drug use, how the pandemic is affecting substance use and treatment. And be aware that you have opportunity to go either on chat or Q&A at the bottom of your screen, and we'll be dealing with those questions after Katie does her presentation. So we're happy to have you with us and look forward to Katie's informative and thoughtful presentation. Katie?
Thank you, Bill. So I'm going to pull up my slides now for everyone. So, okay, so right, as Bill said, I'm going to talk a little bit about how the pandemic is affecting both, patterns in drug use and also the availability of drug treatment services. So obviously, the pandemic is creating some challenges in this area, as it is right now in all areas of life. But it is also providing some opportunities that could force improvements in drug policy. I will start with the challenges. So for people that are already dealing with substance use disorders, a lot of services were already in short supply before the pandemic, and COVID-19 has exacerbated those conditions. It's made in-person services unavailable or very restricted. Some treatment providers aren't admitting any new clients. Some have drastically reduced the number of clients that they can take. There are doctors and providers that now offer virtual appointments. Not all can do this because there's some challenges in terms of reimbursements and things like that. And there are also online recovery meetings for people, but these aren't going to be ideal for everyone. A lot of people rely very heavily on the social components of recovery, especially in the beginning. So for people that are just starting out, and they haven't really become fully engaged in their recovery process yet, something like this is likely to derail that effort or at least make it much harder. And this means that, people might return to or continue or increase their use of drugs or alcohol. And for people that are using illicit drugs, the pandemic is also causing problems in that supply. There have been disruptions due to border closures and travel restrictions, and also just sort of, the general disruptions that we're seeing in other parts of the legal economy that are used generally to also move drugs around the country. So you're seeing reports around the country in different cities of declines in drug quality, less consistency in the product, more additives. These are a problem because they increase the risk for overdose and also for other adverse health reactions. We also have more people in isolation. This might cause people to use more drugs than they normally would. And especially in the case of opioids, using alone can increase the risk of fatal overdoses because there's no one there to call 911 or to administer Narcan, which is an overdose reversal drug. Another problem that we're seeing is a lack of information and also a lot of misinformation about the virus and the risks. I think we see that generally, and I think it's particularly felt among people who have fewer resources. People, for example, who are homeless or who were just recently incarcerated, they might not have phones or internet access. They might be distrustful of the information that they're getting from the government or from, different health services. And the information gap is something that, people that work in harm reduction are aware of. They are trying very hard to make clients aware of the risks of contracting COVID-19 that come with some drug practices. So this is an example of a flyer that was created by a health services organization in the UK. And you can see, that the flyer in the beginning, it says, there's always a risk when taking drugs. It stresses that you shouldn't do it, that it increases your risk. But if you are going to be using drugs, here are some tips to do it more safely, right? So, washing your hands for 20 seconds, disinfecting the surfaces that you are putting drugs on, not sharing use equipment with people, which, I think a lot of people know, not to share needles, but I think, other kinds of common sharing practices, like sharing a joint, for example, right now in this environment really isn't safe at all. And so, this is a kind of example of the information that people are trying to provide to people who are using drugs. But even when people are getting accurate information about the virus, sometimes it's not always easy to follow the protocols, right? So, social distancing and frequent hand washing aren't going to be that easy for people depending on their circumstances, if they're living on the street or if they're in a shelter where, they're in close quarters with other people. And again, as I mentioned, people that are, just getting out of jail or people who are homeless, they rely on a lot of resources that now might not be there. For example, food banks, right now are kind of being stretched to their capacity. You also have, people that are recently released from jail, they typically rely heavily on family support structures, and these might now be limited also due to the virus. And all of these populations, people who use drugs, people who are formerly incarcerated, people who are homeless, they all overlap with each other. They're also likely to have health conditions that make them susceptible to the virus and complications from the virus. They also typically don't have a regular physician or insurance. Many of them rely on the ER as their primary means of receiving any kind of healthcare. And so all of this puts them at risk for contracting the virus, and it also can stress the public health system that we all are really depending on right now. So, we have the pandemic is kind of creating even greater risks for people who are already in these high-risk environments. But we also might be seeing that the pandemic is going to increase the extent to which some people, who were using drugs and alcohol, maybe just occasionally or non-problematically, might now be using them more as a way to cope with the pandemic and the stress that it's causing. And we have some data to kind of indicate at least that sales are up. So Americans are spending more on alcohol mid-March this year compared to last year. It's hard to tell really just from sales data what's happening, right? So it could be that people are drinking more, or it could be that they are stocking up, or it could just reflect a shift, from people that were drinking in bars and restaurants to now drinking at their home. It's probably a combination of these things, but we're going to have to see sort of how it plays out. And as for cannabis, we have data this is from California, Washington, and Colorado that shows that sales in states where it's legal have spiked again in mid-March. I'm still waiting to see more complete data from April, but so far what I've seen also shows that sales are up significantly at this time this year compared to last year. There's also been a huge spike in online sales, which makes sense given the social distancing protocols that a lot of people are trying to follow. Again, sales data isn't the greatest measure for use, and there have been a few surveys that have started to ask people about their drinking habits during lockdown. Not quite enough to really draw up firm conclusions, but we do see some trends that are emerging. So this data is based on a poll that was conducted in early April about 2,200 people in the U.S. It found that 28% of respondents said they're eating more, 16% said they're drinking more. If you look, millennials are more likely to say they do both. About 25% of millennials say that they are drinking more. You see that there are also people that say that they're doing these things less. And I think that is one of the things that we're starting to see emerge, is that people who were drinking very infrequently prior to the pandemic might be decreasing their use. So if they only drank, once or twice a week at a happy hour event after work, for example, might not be drinking so much anymore because those events are no longer going on. Whereas people that maybe already were drinking on a regular basis to kind of unwind or something like that might be increasing their use. As for illicit drugs, unfortunately, no one is tracking consumer habits, but I'm sure that there's going to be research, that will be underway shortly to look at those patterns if it isn't already. I've done a bit of my own very informal research. They've also looked at a lot of news reports on this that show that, again, illicit drug use is basically continuing as it was before, with some changes in use. And again, it kind of depends on the purpose, I think, that a lot of people had for using drugs in the first place. So, people that only used in party scenes, or like when they went to a rave or a festival or that kind of thing, might be decreasing their use because those events are no longer going on, versus people who used in smaller group settings or alone might be seeing an increase in their use. So to recap the challenges, the pandemic, again, is kind of worsening these conditions for people with addiction problems, especially those that are in vulnerable circumstances. And it also may be causing increased substance use among people who are only using occasionally, or, if regularly, not problematically. That said, though, we also have seen some changes that have been necessary in response to the virus that are positive developments that I hope that we can keep up when the virus does eventually subside. In terms of services for people with substance use disorders, the social distancing measures have required a lot more flexibility and innovation in terms of service delivery. So for example, I mentioned the online meetings, online recovery meetings, and they're not ideal for everyone, but maybe now they're being seen as more of an alternative for people, who were used to going to in-person recovery meetings and may never have considered joining on an online meeting before this. If they couldn't make a meeting, they just missed their meeting. But now, maybe that online meeting doesn't seem like such a bad idea. And so in this way, I think that the pandemic can be making us more aware of our possibilities. I think this is true in many areas of life, not just in, drug treatment. In New York City, the city has started to allow methadone clinics to deliver their medications to people, so sort of like a courier service for methadone. So that's kind of an example, when I talk about the sort of innovative and flexible service delivery that we're seeing. The Drug Enforcement Administration has also relaxed restrictions on medication-assisted treatment for opioids. So there's two primary drugs that are opioid substitution therapies. There's buprenorphine and methadone. They both have a ton of sort of regulations around their prescribing. Buprenorphine slightly less. You can get it from a doctor's office, but it used to be that you had to go in person. And there's some other also kind of requirements around it. But now patients can get it with a telehealth appointment. And so they don't have to go in person. And this was something that was already in demand in especially rural areas before the pandemic started. I think, we're starting to see an increased demand for that service now. And I think that we'll continue to see that demand as the pandemic subsides. Methadone has had even greater restrictions. Methadone is usually prescribed in a kind of standalone methadone clinic. You can't get it from a regular doctor's office, and most methadone patients have to go every single day in person to get their dose. But now they're allowed, clinics are allowed to give people more take-home doses that last up to a month. And these are really welcome changes, I think, that make treatment more accessible. A lot of us are hoping that we can kind of keep some of these changes and some of these relaxed restrictions. Another positive change is that there have been declines in arrests and fewer incarcerations of people with drug possession. This is an effort, to reduce the contact that law enforcement has to have with people, and also to reduce jail populations in order to slow the spread of COVID-19. And again, I think that, there are places that will try to make these more permanent features of their public safety priorities. I think others will be very eager to get back to business as usual. And lastly, to the extent, again, that drug use does increase in response to COVID-19, maybe we can actually get a clearer understanding of why people actually use drugs, and we can come to see it as an adaptive response to a stressful environment. And I'm going to talk a little bit more about this, about the adaptive response, because how we understand drug use and addiction really does have important implications for the kinds of policy solutions that we find acceptable and desirable. So, it may sound obvious when I say that, drug use is a reaction to external stress, but the American response, we've rarely treated it in that way, right? So we've either kind of considered it a moral failing that makes someone dangerous and, requires punishment, or we've seen it sort of as a brain disease or some mixture of both. And so right now, the prevailing view is that addiction is a brain disease that, with prolonged use, it hijacks the brain's reward system and it leaves the person powerless over cravings. It's often now likened to a chronic illness, like diabetes or hypertension. And, these analogies, I think, have helped gain support for things like medication-assisted treatment for opioid use. But it doesn't adequately account for the external context that influences a person's drug use behavior. It also doesn't really explain why people respond to drugs differently in different situations, or why most drug use never progresses to addiction. And one famous example I think that's really instructive is the rat park experiments that they were conducted by a drug researcher named Bruce Alexander in the 1970s. With these experiments, there were rats that were in social isolation in cages who, were addicted to a morphine drip, self-administered morphine. When the rats were taken out of social isolation, they were given toys and rat friends to play with in what was called Rat Park. They became much less interested in the morphine. And that showed, I think, very strongly the role that the environment played in drug use. And, you know, I think a lot of people now do recognize that drug use and addiction are how some people adapt to issues like economic hardship and, you know, trauma and social isolation. And these are all things that the pandemic is worsening. These, you know, we're not all experiencing these problems to the same degree. And, you know, people have different kinds of coping mechanisms. Some have healthier coping mechanisms than others. But, you know, the uncertainty and anxiety now are very central features of life now for hundreds of millions of people in a way that they never were before. So if more people use drugs or alcohol to cope with the pandemic or use them more often, then the question is, does this mean, you know, that rates of addiction are going to increase? And I think that's really going to depend on the extent of the damage caused by COVID-19. If we figure out how to resume economic and social activity, and if we can do it in a way that doesn't cause a deadly surge in cases, and we can limit the long-term economic damage, then I think it's unlikely that COVID-19 is going to cause a large increase in addiction. And I think we can be relatively confident in that prediction because the vast majority of people who use substances, even drugs like heroin and meth, don't develop substance use disorders. And even when people do develop substance use disorders, they typically resolve on their own without outside intervention. And just, you know, part of this has to do with aging out of drug use. And so to give you an idea, this chart shows the rates of substance use disorder by age. So the blue part shows rates of illicit substance use disorders with illicit drugs, and then the orange is for alcohol. So for one thing, you can see that alcohol is much more of a problem than other drugs, especially among older Americans. But you also see the trend that rates of substance use disorders decline with age. These are data just for 2018, but this data has been collected for about 40 years now, and you can look over any year basically, and you can see the same trend. And I think a specific example that is instructive for our current circumstances is the case of American soldiers that were returning from Vietnam War. There were reports of large rates of heroin addiction among soldiers, and there's a major concern here in the US that we were going to have this huge population of drug addicted vets coming home. But these soldiers, even though they reported addiction while they were overseas, when they came home, they ceased or vastly reduced their use. There are some famous studies of this population that showed that remission from addiction was an estimated 95%. So this, you know, sort of suggests that their addiction to heroin was not necessarily a brain disease, but more a product of their circumstances. And so that's why, you know, I feel like if the conditions that were created by COVID-19 that caused some people to drink or use drugs more go away, then that extra use is also likely to diminish. But, you know, if the impacts of the virus are more permanent, then I think there's more cause for concern because it will increase the risk that people will use drugs to cope, and it will also mean that they have little incentive to stop. You know, and given kind of how this disease is progressing and sort of the damage that we're seeing so far, you know, I think it makes sense to be prepared, right? So what should we do? First, I really do believe that this is an opportunity for us to speak more frankly about drug use without moralizing or medicalizing it. I think it's really important that we acknowledge that most drug use is not problematic. And I also think that we need to reassure people that substance use is a very natural response to stress. And this is really important messaging because the stigma that surrounds drug use is very serious. You know, people internalize it, and then it prevents them from talking about their challenges or from seeking help. And it can also make them feel like they don't have any control over their use, like they're powerless, which is not helpful and is also not true. People who use drugs typically already have strategies for managing their use. These include things like keeping track of their patterns of use, limiting the amount that they consume in a given time period, and also only using under certain conditions. So, you know, with specific people or with a specific intent or mindset. And these are skills that can reduce the likelihood that people will develop substance use disorders. And they seem pretty relevant in the face of stressors like COVID-19. I think so messages about the risks of drug use should also contain information about how to use more safely or how to keep that use under control. And at the same time, we do need to be prepared for the prospect of increased rates of addiction during and following the epidemic, and an increased demand for treatment services as well as mental health services. Again, these are things that have already been limited. So, one obvious thing we need to do, is we always need more funding. We also need better insurance coverage for these issues. Beyond that, though, we really need to invest in interventions that target underlying needs. The federal government has thrown a whole lot of money at the opioid epidemic, mostly in the form of traditional drug treatment services. And this is great. That's been money that is needed. But if we go back to the premise that, a lot of problematic drug use comes from external stress, then we should also be focusing on changing the conditions that led to that use. And so this will mean larger upfront investments in things like housing and preventive, physical and mental health services. I think we need to, sort of reorient ourselves away from the goal. The primary goal shouldn't necessarily be stopping a person's drug use, but, stopping the conditions that led to that drug use and changing and improving that person's life. And, I think right now, I hope that we're in a situation where, if we can get anything positive to come out of this, one will be that we, can adjust from failed policies now that, we have an opportunity to do so. I am going to stop there, but I wanted to give you all a couple of resources in case you're interested. So some resources for online recovery meetings, and then also some other materials about harm reduction, about reducing your alcohol consumption, or how to use other drugs more safely. And so that is it. And we can now take questions.
Thank you, Katie. Let's see. Well, probably the questions will just be starting here, but I have a question or two to ask you. You talked about what people using them and using the various drugs and becoming, and does using drugs and alcohol, if the pandemic does make them use it more, does it make them more susceptible to COVID complications? If they get it, how are they in a worse shape for having used alcohol and drugs, and perhaps more alcohol and other drugs, I should say?
Yeah, so it kind of depends on the individual circumstances and how heavy the use is. So I think there's a good reason to think that things like smoking, for example, can lead to increased complications because of the damage that smoking does to your respiratory system. With alcohol, heavy alcohol use can lead to a compromised immune system and other sort of underlying conditions, problems with your liver and problems with your other internal organs that can, I think, also make you more susceptible to the disease. And again, with COVID-19, it started out as a respiratory disease, and now we're seeing that it can affect other organs as well. There has been speculation in terms of, for opioid use, there's been speculation that people who use opioids are more susceptible to COVID-19, to an overdose, if they also have COVID-19, because of that it's a respiratory infection, and that opioid overdoses involve respiratory depression. But there hasn't really been a lot of strong evidence for that. So, I think that's something that we're going to have to see more evidence before we can really be telling people that is a significant concern. But certainly, heavier drug use and prolonged drug use can lead to, adverse health consequences that, again, sort of are these underlying conditions that have made people more susceptible to the disease.
Yeah. We have a question here. Do you have any advice for specific messages for youth?
I think that, there are a couple of, I guess, in terms of in relation to COVID-19 or just generally.
Well, I think we'll stick with that today.
Okay.
We can lots of the young people.
Yeah. So I think, I think certainly with people that are, in their late teens and early 20s, I think that there's been sort of the continuing misconception just that they are immune from the disease in general. But I think that, the thing that works best is information. And so, there's already been, there's been some evidence, this is kind of prior to the pandemic, of providing information in, bars and nightclubs and that kind of thing where young people go, warning them, for example, that, if they're doing cocaine, that there's fentanyl in the cocaine supply in that area. And just telling people, giving them that information can lead to them adjusting their use patterns. It doesn't necessarily mean that they're not going to use, but it can help them use more safely. And, the other kinds of things are test strips so that people can see what's in their drugs. These kinds of things are, again, they're not going to necessarily make people stop using drugs, but it's important information that can help them adjust. In terms of, middle school and high school and prevention messages, again, I think that what we're seeing works best is giving people factual information about drugs, not trying to scare people. And then also really focusing on providing people with tools to build their self-esteem and tools to enjoy life outside of drug use, more than scaring them about how drugs are going to ruin their lives.
Well, on that subject about youth, you and I have written a paper on vaping. It's called Clearing the Air, which would be certainly invite people to look at. But say something about, vaping is better. We're contending that vaping is better than smoking cigarettes. Cigarettes are really, really bad for you, and vaping may be only sort of bad for you, but not as bad as cigarettes. However, say something about what vaping can do that can make the COVID more harmful.
Well, I mean, there is evidence that vaping can cause lung damage. And so to the extent that it compromises your respiratory functions, and COVID-19 is a respiratory infection, that can lead to, or possibly can lead to complications. I mean, we still don't have like a whole lot of evidence from that, but I think, it's easy to kind of put 2 and 2 together, at least for right now. And to warn people that the vaping can make them more susceptible. That said, I would argue that vaping still makes them less susceptible than smoking to the COVID complications. So it's still, for people that are already sort of dependent on nicotine, the vaping is still, I would say, a less harmful alternative. But you brought up the vaping bill, and I think, one of the things about kids and sort of the concerns about vaping, one thing to focus on, I think, when you're trying to get kids not to do it, isn't necessarily that, they might have problems with their lungs, 20 years down the line, because that's a long-term message that I think people that are younger don't necessarily really take in that well. But I think focusing on the nagging quality of a nicotine addiction, I think is a better message there.
Here's a question. And it's actually 3 questions, I think, but it's complicated and they're good. This is from Sandy Olson, whom we know.
Hi, Sandy.
Hi, Sandy. Would messages about practicing universal precautions when using alcohol and other drugs be helpful for prevention/harm reduction down the road?
Yeah, I absolutely think that they would. Yeah, I think, I think, and Sandy, you probably agree with us on this, that, we've been frustrated with the sort of the complete different treatment that alcohol gets from other drugs. And, even now with the COVID-19 stuff going on, I see memes every day about people joking about how much they're drinking now. And I think, that really focusing sort of on those like sort of healthy limit campaigns is a really important approach for drinking. And I think that same kind of messaging can be applied for other drugs. And I think it's important now, and I think it's important outside of pandemic circumstances as well.
And as the chart you showed, and you mentioned it also, alcohol is clearly the most important and most serious substance use disorder we have in this country, and has been for decades and decades. Reliably and consistently, about 2/3 of the people with a substance use disorder, it's alcohol only. And another 15% or so is alcohol and illicit drugs, or dangerous drugs that may not be illicit, like some prescription drugs. And only about a little less than 20% typically year to year is illicit drugs only. So when we emphasize that when we're talking about drug problems, you need to start with the fact that 2/3 of them and up to 80% are just mainly alcohol. So we hope that as you say, I have friends too also who talk about putting on putting on their day pajamas so they can drink alcohol more
Right.
responsibly. But yes, that's good to point out the importance of that. Sandy asks another question here. Will needle exchange programs become more acceptable as harm reduction? I've certainly done a lot of work on needle exchange programs for the last 19 years of the drug policy program. In fact, it was the first issue that I took on because I thought once I explained the science behind needle exchange and how it absolutely reduces the harms of using needles without encouraging more people to use needles, without it works. It works everywhere it's tried, and it's tried in most states except Texas. And now we do have finally, after wrangling with the legislature and for years, we do have a what's the word I'm looking for? It's a pilot program.
The pilot program
in San Antonio in Bexar County, which the legislature did allow in 2009, and has finally gone through the hoops to get that started. But it's very small, but it does work. We'll look this year and see how well it's working. But needle exchange programs do work as harm reduction. It's something that everyone ought to encourage their legislatures in Texas to stand up for. But that it's maybe helpful in preparing and talking to people about what's safe, what is safe with using drugs, to bring up and emphasize, if you're going to do this, it's especially important. It's always important, but it's especially important to exercise the greatest caution, the greatest sterilizing and using only clean needles if you are going to use that. Now, of course, an objection we often get is, well, you're just encouraged. You're saying it's all right it's all right to shoot up. Our position on that is, not many people say, well, now that I can get sterile and syringes, I think I'll become a heroin addict. There's several steps between that. But in any case, we do stand. Sandy also asked, will harm reduction become more acceptable? We certainly hope so. We say in most of our publications that we stand for harm reduction, for regulation, taxation, reasonable recognition that prohibition, we are not going to have zero tolerance. We can have zero tolerance. We're not going to have a drug-free America. So that we need to say, these are harms, we recognize them. We're not going to be able to eliminate them, but let's see what we can do to make those less harmful. Now, that's not the same thing as saying, oh, well, we'll do whatever you want.
Right. And I think, Sandy, to your point, I think that, I am kind of hopeful that one of the things that we will get out of this is that harm reduction will be more accepted, and just in the sense that it's a more practical approach. And I think that what we're seeing is that there's going to be a lot of changes on different aspects of life that are going to be more pragmatic. People are already talking about how, all these jobs, all these people now are working from home. Well, we could be doing that a whole lot more after the pandemic subsides, and how that can reduce traffic and, emissions and that kind of thing. So I think that, again, when I talk about sort of how this can make us aware of other possibilities, I hope that not everything goes back to normal. And I hope that we can be more pragmatic about things like drug use, and just say, this is not a tenable way to do this. We need to do something else. That's my hope.
Here's from Benjamin Lynch. What are your thoughts about how increased abuse will delay or retard the adoption of medical marijuana or recreational cannabis use across the USA? I'm sort of like that too.
I kind of reached a point now. Sorry, what did you say, Bill?
I just said my screen paused you, and I was thinking, I'm pausing here too. Go ahead.
Well, I was going to say that I think that we've kind of gotten to a point right now where marijuana sort of is being treated differently than other sorts of drugs. I mean, in terms of policy, but also just in terms of the popular imagination, the popular concept, and of smoking marijuana versus using other drugs. I think that's part of the reason that we've seen this great expansion of legalization. I don't really think that whatever trends or patterns there are in pandemic related drug use, I don't really think that's going to have a huge impact on medical legalization. You know, whether or not it affects how some states legalize, how long it takes, you know, because there's other kinds of priorities, or what kinds of regulations they put up around it. I think that you know, we're just going to have to see, and I think it'll sort of be on a state by state basis. But I don't know that, you know, that aspect of it is going to change that much. Like, for example, here in Texas, I don't know that the pandemic is really going to change the conversation around legalization that much, if at all. At this point, I would be surprised if it did, other than maybe on decriminalization.
Well, we can also invite people. We prepared for the coinciding with the legislature last year, 2 papers, one on decriminalization of marijuana, fears and facts, and another on medical marijuana. And we'd invite people. If you go to the drug policy page, we have bars that indicate down at the bottom right that show different specialties that we have. And one of them is cannabis policy. And you can find our co-written papers on decriminalization and on medical marijuana there, and we invite you to do that. Let's see. Well, I have a question here. You're talking about, we keep talking about reducing the stigma, decriminalization. Are you thinking about we should just reduce stigma about all drug use, or decriminalizing all of the drugs?
I think that I do think that we need to reduce stigma around all drug use. And I think that will involve decriminalizing use and possession for the purposes of use. I'm not saying that, you know, we shouldn't still be trying to arrest people that are moving 250 tons of meth across the border. You know, I mean, I think there's still a legitimate, you know, purpose in pursuing that route. But again, you know, we know from decades that, you know, they only get so much that comes over the border or that goes across states. I mean, people are going to find access to drugs. I think that, you know, with the opioid epidemic and the fact that so much of it started with prescription pills, I think that there has been a lot of reduced stigma around that. But right now, you know, we're seeing these sort of different phases of the opioid epidemic, and we're seeing now a much greater stimulant use. And I think that, you know, to me, you know, meth to me seems to be one of the drugs that continues to be the most stigmatized. And I think that is really, you know, can be really hurtful for the people that are using. I think it can make it difficult for people to get help. And so I do think that we need to move in the direction of reducing stigma around all drug use. And again, seeing it as, you know, sort of an adaptive response to people's stressful environments. And that's why I say, you know, I think that traditional drug treatment services are important, and we should be trying to get people help that they need, but I think we also need to focus on other interventions as well.
When talking about substance use disorder and addiction, when we talk about substance use disorder, it can include physical dependence. It certainly includes addiction. Can you differentiate a bit between those, or show the nuances between when talking about physical dependence and addiction?
Yeah, so I think this is a really important distinction that I think often gets lost. So when we talk about dependence, about physical dependence, that means that your body is literally dependent on a substance, right? So with opioids, if you're prescribed, you know, 7 to 10 days of opioids after surgery, and you take them consistently for that 7 to 10 day period, you're going to experience some level of physical withdrawals. Maybe not the most severe, but it probably won't be pleasant. I know that from my own experiences after taking them for surgeries, that I can tell when I stop taking them. And you know, so that's dependence right there. That's those feelings of withdrawal is an example of a physical dependence. That doesn't necessarily mean that someone is addicted to a drug. And addiction is really defined by the psychological components and the behaviors surrounding drug use. So you know, the DSM-5 manual kind of has a list of criteria for what qualifies someone as having a substance use disorder. And you know, someone can have a mild or moderate or severe disorder, but it's usually, you know, physical dependence can be one characteristic, but it's also characterized by things like, you know, wanting to stop and not being able to, neglecting other responsibilities like family or job in order to find drugs, being completely consumed with getting high. I mean, those are kind of just examples of those behaviors. And that is sort of, I think, what really, classifies something as an addiction versus just being physically dependent on something because, you've been taking painkillers for chronic pain for a couple of months.
What if you know this, how has Houston's drug market been affected by the pandemic?
Yeah, so I just spoke with an HPD narcotics officer a couple of days ago and was talking to him about this because, there have been reports now from a lot of cities where they've said that, they're seeing a decline in drug supply. And what he said right now in the Houston area is that so far is not that they haven't seen a really big decline in supply. There's, meth and heroin are pretty plentiful here. And he thinks that part of the reason is that, the people in the area that kind of control the market already sort of had a huge stockpile. And so, they haven't really had any shortage yet. And, but, once, if and when they start to once those sources deplete, then, maybe we'll start to see drugs on the street having more additives. He did say that there's kind of a lot of price gouging going on, so things are costing a lot more than they used to. But
masks and sanitizing.
Yeah, right. But yeah, so drugs are still available in Houston. And I would add also, just in terms of the supply stuff, that I think that another thing that you're going to see, is more people, and you're already sort of seeing this, more people going online to buy drugs. And those markets have also been a little bit disrupted because, people in the US used to be able to kind of just buy drugs from anywhere in the world. And that has become much more difficult, for people that were buying something, say, from someone in Europe. That right now is a much harder thing to do. So those online markets are also kind of being disrupted. At the same time, I think a lot of people are turning to them as kind of what they see as like a safer alternative because, they don't have to interact with people on the street and that kind of thing.
It's interesting also, it's really not part of this conversation so much, but that we know that particularly in West Virginia is a key example. A lot of the people switched to heroin when they couldn't get the pharmaceutical drugs as easily or as inexpensively. That led, and then there, of course, the fentanyl came in, and you had but you know more about that than I do.
Well, yeah, but then just right, and so then the fentanyl came in, but now what you're seeing in those areas is an increase in meth use also because meth has become so much more prevalent, more available, and also cheaper. And people. What did you say?
You can make that in your trailer.
Right. Yeah. Although, I mean, a lot of it now, really is coming in south of the border. But, I think it's just, again, testament to the idea that, you can try to limit the supply all you want, but if people want to get high, they're going to figure out a way to get high.
Sandy has she's a wonderful listener here.
Yeah, Sandy.
Are there other ways you can suggest for us to capitalize on this new world situation through messaging and education for prevention and for recovery? She also adds here, and this is interesting, I find that there's a stigma around recovery as well. That, to say I'm in recovery, for some people, they may be in recovery and it's helping them, but there's, I don't want to mention that.
Yeah, I think you're right. I think that there is stigma around it. I think, so two things. One, I would say, for me, I think that there's the kind of the idea of recovery as a process versus recovery as a goal, and the idea of being able to incorporate, harm reduction and reducing use as, for some people, that's part of their recovery, right? So it doesn't necessarily just have to be abstinence as how we define recovery. So kind of broadening that. But in terms of the prevention stuff and awareness, I see every day, I see articles about, mental illness in relation to COVID-19. I hear things on the radio, I see them in the mainstream paper about, how to deal with the mental stress that's going on around this and, taking walks and getting into routine and all of these things that are really good advice. But I think that the substance use needs to become part of that conversation. We know that mental health and substance use illnesses go together quite frequently. And so I think that the way that we have kind of mainstreamed this conversation about mental illness, which is still, even though we've done that, and people still have internal stigma about mental illness, I think that the substance use has to be a part of that conversation. And I think that we have to acknowledge that substance use is how some people deal with you know, depression or anxiety or whatever else, you know, post-traumatic stress that they're dealing with. And not to say that that's a good way to deal with it necessarily, that that's how they should be doing it, but just to really normalize that as a very human response. And I think we have to see it, you know, that conversation is going on among some, you know, some aspects of the treatment community and like within harm reduction circles, but we need to see it in the Houston Chronicle and the New York Times and, you know, all of the places where the conversations about mental health are happening, that needs to encompass drug use that doesn't just focus on, you know, the worst aspects of addiction.
Well, the next question from our good friend Jax Finkel.
Oh, hi, Jax.
Yeah, it's quite pertinent. Well, not that she would ask an impertinent or a non-pertinent question, but just says, how do you think COVID will affect the Institute, the Baker Institute's ability to educate and engage with legislatures on these important issues?
Well, you know, I think, I mean, a lot of stuff is up in the air, you know, for organizations everywhere. I mean, we're fortunate that, you know, Bill and I, and, you know, our position at the Baker Institute is secure. And so we intend to continue with what we're doing right now. You know, we are a nonprofit, and I think all nonprofits are experiencing challenges right now in terms of, you know, revenue streams and that kind of thing. And so that's something that I think everybody's going to be grappling with. In terms of making connections with legislators, you know, I'm really interested to see how things are going to play out, you know, after the elections and what they're going to be planning to do with the sessions. I mean, I just think, you know, right now, you know, I don't know, you know, we're opening the state back up right now, but it's really hard to be able to say that, you know, next year, this time next year, are they going to be, you know, are people going to be at the Capitol the way that they normally are? We just don't know. And so I think that seeing how, you know, business as usual kind of plays out is going to impact how, you know, we try to connect with the legislators and how a lot of groups do that. But certainly we're going to continue to try our best to make connections and to say things to people and to try to get them to listen to us.
And we do, I think we have, it's maybe self-serving to say this, but I think that because it's the James A. Baker III Institute for Public Policy, and if you ask Mr. Baker, he would tell, Secretary Baker would tell you that he believes what we're doing is the right thing to do, that we have a legitimacy, and we are trying to follow data-based, tested you know, measures, talking about this thing, not just saying, no, we got to legalize marijuana because I really miss it. I don't want to have to go to, I feel bad when I have to go to my dealer in a bad corner. So I think we have the legitimacy. We are working on this, and we have the benefit of having been experienced with doing serious research. And I think that helps us. Not to say that other people doing serious research like Jax Finkel doesn't know what she's doing, because she certainly does. Let's see. Well, thanks, Jess. Laura Torres asked, what additives are you referring to? I'm not.
Oh, I think, well, because I mentioned that the drug supply has seen different kinds of additives. So it sort of depends on the drug and the different markets. So there have been reports. So, you know, fentanyl and fentanyl analogs are sort of some of the most common additives, obviously, to what's sold on the street as heroin. But you're starting to see, you know, fentanyl coming up in cocaine supplies also, which is a little unusual, just given that cocaine is a stimulant and fentanyl is a depressant. So usually people that are doing cocaine don't want fentanyl in their cocaine. But you're also starting to see things cut, you know, it could be something relatively harmless like caffeine showing up more in drugs. There are actually reports in Seattle where they were seeing in their stimulant supply things cut with things like PCP. You know, and hallucinogens, which again, you know, if you're buying a stimulant like meth or something like that, you're not really expecting there to be PCP in it. So it sort of varies greatly by each individual market, because a lot of those additives don't happen at the wholesale level. They kind of happen at the retail level. So it's, you know, people that bought things wholesale and then they're cutting it to increase their own profits. And different people are going to cut things with different stuff. So I'm actually waiting right now on data from the Houston Forensic Science Center that kind of breaks down sort of what they're seeing in drug seizures locally. But yeah, it's a fascinating area to look at.
We don't dislike coming to work. No, we don't feel we're not going to be running out of topics. Is non-prescribed ketamine a considerable issue in Houston area? This is another question from Laura Torres.
Is as an issue in terms of a yeah, I wouldn't call it an issue in terms of it being a significant drug of abuse and addiction. I think that there is certainly an increase in interest in ketamine. I think, locally and nationally, I mean, there's been some pretty good research showing that it can be helpful for depression. I think my very informal research on this, a lot of people that buy ketamine purchase it online. And so it's not necessarily coming, people in Houston might be getting it from online sources and then, selling it to friends. So I don't know the exact extent of use. I would say that it is relatively small. And in terms of how problematic it is, I'm going to say not that problematic, just based on, it's not a drug that makes, creates or induces psychosis in people or that kind of thing. And, people can go on binges, but it's not, I don't think it's a significant problem. No.
We need to wrap up. Can you say just a little bit about what ketamine does?
So ketamine is it's a sort of a dissociative drug. It can sort of, can help people kind of disconnect from the environment that they're in. And so I think that's part of the way that it's been useful to treat depression, because it can kind of take people out of, negative thought patterns, for example, that they're having. I think right now, one of the reasons that there's an interest in a drug like that is because people are sort of experiencing, again, all of this sort of externally induced, anxiety and stress and depression. And so, a drug that kind of lets you sort of disconnect from that outside world and see things in a different way, I think is for some people, a very attractive idea right now, just given what we're going through.
Well, we're going to have to wrap this up, but we appreciate all of our participants. You and I appreciate the participants. But we appreciate the people who were tuning in to us, and seriously invite you to look over our website. We're turning out things with some relative rapidity and a wide range of topics. And we also have people helping us who are non-resident scholars and fellows of the Institute and the Drug Policy Program. But thanks very much for watching and listening, and take care of yourselves. Stay safe. Bye-bye.
Yes, thank you. Bye.